At Brisbane North PHN, our vision is a community where good health is available to everyone. To help us achieve this, we support general practices in the region to deliver high-performing primary care. We do this through a range of quality improvement initiatives. This quality improvement microvideo forms part of a suite of educational videos to provide practice managers, reception staff and practice nurses with tips to implement quality improvement activities in general practice. Welcome to the Brisbane North PHN's Quality Improvement Microvideo series.
Meet Matilda, the new practice manager at Healthy View Practice. It's a small suburban practice with 2 full-time GPs, 2 part-time nurses and 2 administrative supports. The practice recently registered for accreditation, although they have not registered for the practice incentive payment for quality improvement. Matilda's keen to enhance the practice's quality of care. She's noticed they're not utilising continuous quality improvement activities yet. She'd like to start with a simple activity to demonstrate how CQI activities can benefit the whole team and their patients. The practice has Primary Sense installed on 2 workstations, but they don't regularly use the software or view their Primary Sense practice reports. Matilda contacts the PHN's practice support for assistance. The PHN's Quality Improvement and Development Engagement Officer requests to preferably meet with the GP, practice manager, practice nurse and receptionist to utilise the reports in Primary Sense to identify possible areas for quality improvement. The PHN's QI&D Engagement Officer meets with Matilda and the practice CQI team. They're introduced to Primary Sense reports, revealing valuable insights. The staff are amazed at the information and resources available to them and agree to regular catch-ups with the PHN's QI&D engagement officers. The team discovers opportunities for improvement and decide to focus on recording patient smoking status. With support from the QI&D engagement officer to look within the Primary Sense tool, they learn there are a few reports that cover smoking status. They start by viewing the Patients Missing PIP-QI or Accreditation Measures, All Patients Missing Measures report. They learn how to export to Excel, filter the list from there and print if required. The QI&D engagement officer also shows them the patients booked in with missing PIP-QI measures with appointments in the next 2 weeks report. The team learn they can view this report for patients with upcoming appointments and that these reports can also be filtered to an individual doctor and date so the missing measure can be captured at the next consultation. Matilda presents the CQI activity at a whole practice meeting, sharing printouts of the data results for smoking status. Upon further discussion, a GP states they are recording the smoking status in the progress notes instead of the dedicated field in their clinical information system. The team devises a plan, including training, process review and patient follow-up procedures. The plan: add CQI activity to agenda for next meeting. Matilda will write up this planned activity on the PHN's worksheets. The nurse will provide training to all clinical staff as needed on where to record smoking status. Matilda will review their process for recording the new patient information. Reception staff will check patients have completed this section of the new patient form and will add a note in the patient's file for follow-up at the next visit based on the reports. Matilda and the reception staff will make small alert reminder desktop cards for the GP rooms and use a printout of the Primary Sense report for appointments within the next 2 weeks. All the clinical staff agree to record this information for upcoming patients. The team agree to discuss the outcome of this activity at their next meeting. The team implements the plan, ensuring everyone is on board with the new process. At the follow-up meeting, the team reflects on their journey and decides to integrate the process as part of their routine. They have all enjoyed working as a team to complete the activities. They also decide to register for the PIP-QI, embracing continuous quality improvement as part of their practice culture. And so, Healthy View Practice embarked on a journey of continuous quality improvement, enhancing care for their patients and strengthening their practice as a whole. Meet Raphael, an experienced practice manager at a large accredited practice in Brisbane's northern suburbs. With 11 GPs, 3 nurses and 5 administrative staff, Raphael's leadership is a key factor with the clinic's successes. Raphael is passionate about continuous quality improvement. He believes that training staff in CQI not only enhances patient care, but also empowers the team. All staff, GPs, nurses and reception, have KPIs to participate in quality improvement initiatives and attend monthly team meetings as part of their position descriptions. Every fortnight, the dedicated CQI team, coordinated by Raphael, meets to discuss and analyse data. Lunch is provided by the practice. Each year, the practice refreshes the CQI team and reassigns the roles so additional staff can participate and upskill in the area of CQI. The team take time to complete their QI worksheets, analyse their data, and implement a plan to drive the CQI activities specific to their roles. For example, a GP acts as a peer-to-peer support for other GPs in the practice. They save the amended QI worksheet in a local shared drive in preparation for the whole of practice meeting. The latest worksheet is also displayed on the team room notice board. On occasion, the QI team invite the PHN's QI&D engagement officer when an activity is coming to an end to learn more about the upcoming PHN QI projects that their practice can potentially participate in next. At the monthly whole of practice meeting, the CQI team presents their update and findings. They dedicate time to review their activities, celebrate successes, and plan new initiatives. With tools like Primary Sense and support from the PHN's QI&D engagement officers, the team has access to the resources they need to excel at their roles. This structure has not only improved patient care, but has brought the entire team closer together, creating a strong culture of continuous improvement. North Brisbane Clinic continues to strive for and reach targets for their practice, proving that a commitment to continuous quality improvement can lead to real change.
This microvideo is supported by funding from Brisbane North PHN through the Australian Government's PHN program.